Project coordinator and researcher for the international human rights group Reprieve. He joins us on Skype from London. Thank you very much for joining us. It's been described as a race now, a race to try and stop this deadly outbreak. What is most needed in this race?
Good evening to you, Sue, and to all of your audience. It's worth mentioning that this is not the first time that cholera outbreaks in the country. However, the main difference is that this time there is no functioning state. So in the past, the government institutions, immediately when there is a response by the UN different humanitarian agencies, they're able to cope with the situation quite quickly. The current situation, the UN might try to respond. They might provide some temporary solutions, but the state is collapsing. There's a situation where the health sector has been literally no individual has received their salaries for the last at least 8 months. The hospitals are barely functioning, as you mentioned in your report, and the conflict isn't ending anytime soon. So without any government-led intervention, I'm afraid that even with the UN humanitarian response, the response will be very limited.
Human Rights Watch has documented over 80 what it's calling unlawful attacks, schools, markets, homes, hospitals. At the same time, we've got the Saudi prince saying he wants to donate $60 million to try and aid the crisis. Surely the best thing to do would be to stop this Saudi-led coalition of the attacks rather than handing out money to try and ease the situation on the ground.
Well, I mean, as you mentioned, the issue is a little bit more complicated than this. So since September 2014, if I'd be more accurate, the state institutions started collapsing one after another, and then it's collapsing in a rate that is much faster than the ability of any humanitarian organization to respond. So even with the funding by the Salman Humanitarian Center, I'm afraid it's not going to really help the situation. And over the past 2.5 years, the central bank have been drained out of the cash to fund literally the battlefronts. So what you have is that money is going to the conflict, and we see billions of dollars easily being spent when it comes to the war. But when it comes to the salaries and the need of the humanitarian need of the majority of the Yemeni people, this is when we see like we're gonna make some donations just to cover up for the dire humanitarian situation that has been caused by the conflict.
Does it feel like the international community has almost been sleepwalking into this crisis? It feels almost like a war that's been pushed to one side with these various attacks gone sort of unaccountable, really. And I'm sure as an NGO on the ground, you're well aware of what's been going on, but really the attention hasn't been on this growing epidemic.
Yeah, I mean, I think many international players thought that the conflict is going to end quite quickly after the intervention of the Saudi-led coalition. However, now we are at 2.5 years, and it doesn't, there are no signs of ending anytime soon. And I think this is what's worrying most of the Yemeni people. Most of the Yemeni people just need to return to back to their normal lives. And there has been constant and additional challenges facing organizations working on the ground. And the other important issue is that any international organization, can't make up for the absence of a state. The government needs to take the lead, and both authorities, I'm afraid, either the ones in Sana'a or the legitimate government in Aden, hasn't been responsive enough, and I would say responsible enough to really face up the challenge, and especially as something like cholera, which is containable. It is a solution is possible, but it needs a government-led initiative.
We are grateful for your thoughts on this. Baraa Shiban speaking to us live there from London.